There is some confusion among adults about the flu vaccine in Ontario, and it was a viewer tip that prompted us to clear things up, namely why some patients are being asked to pay for a souped-up version of the vaccine, one that covers 4 strains of influenza. Meanwhile, the one that's currently being offered for free covers one less than that.
I had no idea. I should probably know that because I want to get my son immunized as well, and he's 2.
It's been available in Ontario for a year now, but it's only free for those under the age of 17. The Quadrivalent flu vaccine, a shot that protects against 4 strains of influenza versus the standard vaccine that protects against 3. But adults who want it have to pay anywhere between $12 and $25 per dose.
Would I be willing to pay for $25? If I had kids, yes. If not, no.
No.
No, why not?
I just find it's unnecessary because it should be free.
Flu vaccines here have been trivalent for decades, offering protection against 2 types of influenza A and 1 type of influenza B. The quadrivalent offers those plus an extra B. The Ministry of Health says it follows national guidelines, offering the quadrivalent shot for free for kids, but not for adults.
For children, they're more susceptible to a particular strain, a B strain of the virus. So we add that strain annually based on WHO recommendations.
Yet these provinces only offer the 4-strain vaccine and make it free for both children and adults, whereas Ontario, Quebec, Saskatchewan, and BC only cover it for kids. Why isn't Ontario taking the same step?
Oh, we're following the national guidelines.
Is it a cost thing?
Well, we have determined that based on the science and the evidence, the appropriate vaccine for children.
Public Health Ontario says going into year 2, they are still reviewing the shot's effectiveness.
It's possible that as vaccines, as this evolves, that there will be expansion in the future. But for now, we focused on the recommendations of the National Advisory Committee on Immunization.
Some parents in particular think it's better for both young and old to be protected.
We've already had the flu once. I would absolutely would. Yeah, if it saves my family from being sick, especially with that little baby.
And here's something to keep in mind. On the CDC's website, they actually say it's the trivalent shot, the one that I'm actually about to get right now, that offers the best protection for the flu strains that are currently circulating around North America. Any sucker?